Hello everyone, I'm Dr. Syed Jafar, Assistant Professor, Department of Pharmacy Practice. Today we are going to discuss about the medications which are most commonly used in the treatment of gout. So in the previous class we have discussed about the gouty arthritis, how the uric acid levels would be getting accumulated in the joints, and also what happens in the progression of the disease that we have gone for it. So once we are being going for understanding the drug, guys, we have to understand the medications. What are the medications that would be used to decrease the progressions or completely eradicate the problem associated with the uric acids? The first thing is that the non-pharmacological treatment would be coming under it. We have to ask the person to go for the diet restrictions. The most of the cases, the dietitians would be asking the person to go for decrease in the meat consumption, especially the red meat, which has the higher concentration of the purine that would be getting metabolized into the uric acid. And also the smoking and alcohol are the other factors, and most commonly the dietitians and also the doctors would be most precisely asking the person to go for the cessation of this, the consumptions and also the smoking. When it comes under the pharmacological treatment, we do have the medication that are being used for the symptomatic relief, guys. That is to decrease the pain associated with the inflammations in the joints. So the most common medication that are being most commonly used over here are NSAIDs, that is non-steroidal anti-inflammatory drugs. And if at all we are going for more deeper into this one, we do have the medications which are COX-1 as well as the COX-2 inhibitor, because these are the enzymes, or these are the products that would be going for the release of the prostaglandins. That is nothing but the inflammation process would be starting up. So we do have the medications such as the aspirin, low dose aspirin that are being most commonly used in the treatment, and also the high dose of the medication of aspirins are being used as the COX-2 inhibitors. Most precisely, if at all we are going for, we go for the selective COX-2, because those are being associated with the inflammations, inflammatory pathway, the pain sensations, all those in the inflammations pathway would be associated with the COX-2. So we do have the medications such as aspirin over there. We do have the medications such as the celecoxib, rofecoxib, and we do have the medication which are being used as the painkillers and also the anti-inflammatory, such as the paracetamol has been there, aceclofenac has been there, diclofenac has been there, and also the indomethacin, ibuprofen has been there. And we do have the medication of COX-1 also, such as the naproxen and piroxicam. Overall, the cyclooxygenase pathway would be decreased and the inflammation pathway would be decreased. But these medications have some side effects. The major side effects is hepatotoxicity would be associated with. Hepatotoxicity, that is, they would be causing the damage to the liver cells, and they would be depleting the main component of the liver, that is the glutathione. So that would be leading to the hepatocyte damage, cirrhosis would be there. Then the complications would be aggravated whenever a person is being going for a longer term use of this NSAID. The second problem associated with this medication is they would be causing the gastrointestinal mucosal damage, because the PGs, the prostaglandins, as I said you, that COX-1 would be releasing the prostaglandins that would be associated with the mucosal productions. But when we are going for using of this medication for a longer period of time, the PG would be inhibited over there, and you would be able to see a decrease in the lining of mucosals. And if that is being decreased, that would be acting as a protective layer for the epithelial, guys. So if that is been getting damaged, the irritants, the contents of the food or the material whatever we are taking by the oral mouth, that would be causing the epithelial damage, and ultimately the person would be suffering from ulcers formations, or the perforations of the GI tract would be seen. The third thing is that if at all we are using the NSAIDs for a longer period of time, they would be associated with damage to the microflora. The gut microflora would be getting damaged, and again those processes would be leading to the conditions called as the ulcerative colitis and the Crohn disease. And the fourth is if at all we are taking the aspirin, there might be chances of the bleeding risk also, because they would be inhibiting the platelet activation factors called as thromboxane A2, and ultimately you would be able to see the bleeding risk. This is about the NSAID, guys, which are being most commonly used as the analgesic as well as the anti-inflammatory. But remember, when we are speaking about the analgesic, the pain reliever, they are being less pain analgesic when compared to the opioids. We can take the narcotics, we can take the heroin, we can take the morphine, we can take the codeine, we can go for the hydrocodone or oxycodone. They are less analgesic to them, but they would be having the capability to decrease the pain associated with it. Then we do have the medications called as the corticosteroids, because whenever we are speaking about the inflammation, we have to keep in one mind that immune system is been responsible. When we are speaking about the immune system, we need to understand that there would be inflammatory cells and the mediator that would be associated. The first inflammatory mediators would be interleukins. We do have many sub cells over here. Interleukins 2 are there, interleukin 4s are there, interleukin 6 are been there, interleukin 12s are been there. Then tumor necrosis factors would be associated with. Then we do have the IFN alpha receptors also that would be associated with. Then associated with, you do have the basophils, neutrophils, macrophages, then the granulocyte macrophages to colony stimulating factors, histamines are been there. So if at all we want to suppress these all the cells and the mediators, we go for the most common medication that is called as corticosteroids. So in the corticosteroids, we do have the medications of the short acting, the intermediate acting, and the long acting. The short acting medications, if at all we are going for, hydrocortisone would be there. If at all we are going for the intermediate acting, guys, we do have the prednisolone, methylprednisolone, and the last one you would be going for is triamcinolones. And if at all you are going for the last medication, triamcinolones, they are being most commonly used whenever a person is being suffering from pain, fever, inflammations are being there, body ache are being there. This is the choice of the medication which is being given by the doctors for any person who are suffering from the chronic pain. Then we do have the long-acting corticosteroid, guys, wherein we do have the medication called as dexamethasones and the beta-methasones. So when we are speaking about the short acting, we have to understand the T-half of those medications. That is, they would be having around 12 hours of activity and the dose would be ranging from 5 to 10 mg. Hydrocortisone, most commonly we call it as the cortisols, and they are being associated with the hypothalamus and pituitary axis. Then the second one, if at all we are going for the intermediate corticosteroids, we will be able to see the activity for 12 to 36 hours. The T-half would be there associated with them. And we do have the medications of prednisone, methylprednisone, that is, we go for the different doses, 4 mg, 2 mg, and also the 10 mg doses we are going to give. And when we are speaking about the long acting, the T-half would be more than 36 hours. So we go for a smaller dose over here, 0.75 mg of the dexamethasones and also 0.75 mg of the beta-methasones are being given. When we are speaking about the corticosteroids, we have to go for the tapering, because the continuous use of this medication have been shown to cause a decrease or depletion of calcium in the body. Calcium homeostasis would be getting disturbed, by which the person would be suffering from the osteoporosis and also the contractility of the muscles would be decreased. So whenever a person is being going for taking the corticosteroids, we have to go for a tapering. We have to start with a low dose. We have to start with a smaller dose, then we can go for increasing the dose according to it, and then we have to decrease the dose and we have to simultaneously discontinue the medication, because if we are using it, then they would be causing the problem of osteoporosis. So whenever we are using the chronic medications, such as the, if at all we are going for the taking the medication of the corticosteroid for a longer period of time, we have to add calcium in the supplements, and when calcium is being added, we have to go for vitamin D as well. Now, the other medication that would be coming over here is colchicine. This is the medication which does not have the anti-inflammatory activity, but they are be most commonly used in the treatment of gout, because they do have the property of associated with the breakdown of the uric acid, and they would be going for symptomatic relief. So whenever we are going for using the colchicine, we do have a dose of around 2.5 mg. This would be given, and the maximum dose can be given around 4 mg also. This can be given, and this can be treated for a person who is suffering from this the associated issues. So these are the medication which are being given for the symptomatic relief. Now comes the treatment that is being associated with the mean, like is nothing but they would be controlling the uric acid levels. So the first one, if at all you are going for, we do have the uricosuric drugs. Uricosuric drug is nothing but they increase the excretion of the uric acid from the kidney. As we have discussed, because the 90% of the cases associated with the hyperuricemia or the gouty arthritis are being related to the under excretion of the uric acid from the kidney. So we go for the uricosuric drug which helps in the excretion of the uric acid from our plasma. So the first medication we do have is the probenecid. Probenecid medication, they won't allow the reabsorption or the secretions associated with. Reabsorption of the uric acid is not going to be allowed in the PCT, proximal convoluted tubules of the nephrons. Thereby, their secretions would be increased and their chances of the excretions would be increased associated with. So, this is the first line medication that has been most commonly used in the treatment of the gouty arthritis. The second medication that would be given over here is the allopurinols. The allopurinol medications are xanthine oxidase inhibitors. That means the xanthine would be converted into the plasma uric acid. So to avoid the conversion of the xanthine to the uric acid, we go for the allopurinols. This is the best medication that would be decreasing the plasma uric acid concentration. That means they are going to decrease the production. Overproduction of the uric acid would be stopped, and also the person, if at all the diet is being included with the red meat, that would be control associated with. So this is the medication. Allopurinol are being most commonly used and they would be avoiding the productions of the uric acid. This third medication we do have is the febuxostat. This medication is also related to uric acid excretions from our body. Remember this. And we do have the uric acid metabolism medication that would be increasing the metabolism of uric acid so that they would be converted into a very simple forms and they would be getting excreted from our body. So the first medicine is raspberries, the second medication is peglotibase. So these are the medications which are used in the treatment of the gouty arthritis.